We're going to talk about liver failure. So what happens in liver failure and what is our medical nutrition therapy, or what are we going to be recommending? So first, what is happening with liver failure? Obviously, the liver is failing, but we are defining it as a 30% decrease in function. I think I've seen a couple different definitions, if you will, but our liver is starting to not function anymore. So what happens? Well, the first thing we have here is our fat. Our fat cannot be absorbed. It can't be metabolized properly. And so we might have a fatty liver happening. We might have fat in the stool accumulating. And that's the fat in the stool is because we have a lack of bile salts and pancreatic insufficiency, or portal vein is blocked. So those are some of the reasons why we might see fat in the stool with liver failure. Now, when we talk about proteins, our amino acids, so our protein metabolism is altered. So again, we talked about the function of the liver, how we are using amino acids to make glucose whenever we don't have enough carbohydrates in the diet. But anyway, so our liver is involved with the amino acids and our proteins. The branched chain amino acids, they actually are starting to be used for energy, which comes into play here in a minute. And then we have aromatic amino acids, and those amino acids are not being cleared properly. So some changes in our metabolism of protein. We have two, and this is lactulose at the bottom there. Our lactulose, that's going to be given to help, actually, it changes the permeability in the intestines and will induce diarrhea, but it will help remove nitrogen. So that might be something that this patient is prescribed by their doctor or given by their doctor. Another thing with the ammonia. So we talked about ammonia in the liver and how ammonia is converted to urea. So if our liver is failing, that's not happening. So we have a bunch of urea, you know, that's increased in our system. So we can give this patient, or the doctor can give this patient, an antibiotic, and what that antibiotic will do is it'll kill the gut bacteria in our intestine, and that will help decrease ammonia because there are some gut bacteria in our intestine that actually produce it. So that antibiotic will help. So knowing all of that that is going on with your patient, some typical medical nutrition therapy for these patients. In general, we're going to be recommending less than 25% of their calories coming from fat. They may have ascites, or that fluid in the peritoneal cavity. If that is happening, then we're going to obviously put them on a sodium restriction. Some other things to consider, MCT, or medium chain triglycerides. These are going to be better digested for these folks. We also have fat-soluble vitamins. So we know in our liver, that's where our fat-soluble vitamins are stored. So if our liver is failing, we might need to recommend a supplement. This one is just A, D, and E. We know vitamin K is in the intestine. It's made by bacteria in the intestine. So if it advances, then we'll do A, D, and K. Folate, thiamine, B1, and B12, those deficiencies might happen or are likely to happen. So you might need to be aware of folate, thiamine, and B12 with liver failure, so that you may need to see if they need to be supplement with that. All that being said, their labs should be closely monitored. Their supplementation and their quantity should be closely monitored because with these patients, since our liver is not working properly, the upper limits for some of these, even vitamins, they've changed, and now they can be more toxic at a lower level. So just kind of keep that in mind with your liver failure patients if you are doing medical nutrition therapy. So we have what's going on and how that will affect them nutritionally.